bones of upper limb. Okay, so bones of upper limb are so easy. So first of all, there are the bones which we will discuss. Okay, so there are this bone. This is called humerus. Okay, this is actually humerus bone. Humerus bone. Okay, but before this, I will remove all the muscle from this, that you will see each and every bone. Okay, now I removing all the muscle from here. Okay, and after that you will see all the bones from outside. Okay, so you will see in 3D dimension. So just see from the upper side and from the lower side and from all over side. So this is the scapula bone. Okay, and from the posterior side there is a spine. This is called spine, and the muscle before above the spine is called supraspinatus, and below the spine is called infraspinatus. Okay, and this is the clavicle. This is the clavicle. It is concave. It is concave to third. Okay, and one third. Okay, and two third. This is the convex from anterior side. Okay, now you can see here the from the upper side there are many muscle attached. This is the muscle attached to here, the different muscle attached to here. Okay, sternocleidomastoid, etc. Different muscle attached here, but they are not showing. Okay, so the deltoid muscle attached to deltoid pectoralis major muscle, all muscle attached to this. This is the clavicle. Okay, we remove the clavicle and the scapula. Now this is the humerus, and to the lateral side there is the radial bone. Okay, radius bone, and this to the medial side there is the ulnar bone, and also now move below and you will see all the carpal bones. Okay, carpal bones are also so much important here. So in the carpal there are many flexor, there are many retinacula are present. We remove all the retinaculum. Okay, the tendon and retinacula. Okay, so this is the scaphoid bone. This is the scaphoid. After the scaphoid there is the she lunate. After the scaphoid there is the lunate bone. Okay, there are the lunate bone, scaphoid, lunate, triquetrum and falciparum. Then after them triquetrum, capitate, hamate, and she looks too pretty. You have to remember that she looks too pretty. She looks too pretty. Try to catch her. So you have to remember like this. Okay, so scaphoid, lunate, she looks too pretty. Triquetrum, pisiform, and trapezoid, trapezium, trapezoid, capitate, hamate. These are the eight bone. Okay, after that there is the this is the metacarpal. This is the metacarpal. Okay, and after that there are phalanges. This is the two phalanges. Here are three phalanges. Three phalanges are present. Okay, so this we have discussed all the bones. Now we will discuss each and every bone. Okay, yeah, in the slide. Okay, this is the Adil Banduk slide, and you can watch his lecture on the YouTube. But if you can't know the language, there no language, English language is little bit different. Okay, if you can't know, then this lecture is, then I will provide that this will be best. Okay, Adil Banduk slide. So wait for a second, that there is the, so now this is Adil Banduk slides. You can watch his lecture, okay, on YouTube. But if you can't, let's start. So there are shoulder joint. Okay, shoulder, girdle, arm, forearm, and hand. In shoulder there are clavicle and scapula bone. Okay, in the arm there are humerus. In the forearm there is radius and ulna. In the hand, carpal, metacarpal, and phalanges. Okay, this is carpal, metacarpal, phalanges. Bones on the shoulder have two bones. One is the clavicle have one sternal end, that is toward the sternal side, and one is the acromion side, that is toward the acromion side. Now from the upper surface of the clavicle you can see this is the posterior surface, this is the anterior surface, Anterior lateral, one third is the convex. This is one third is convex. Okay, posteriorly. If you see it from posterior, one third is convex posteriorly, and here one third is convex anteriorly. Here is convex posteriorly, here is convex anteriorly. Now shaft is made of medial two third and lateral one third. Lateral one third. Four surface: anterior, posterior, superior, inferior. Now medial end and lateral end. There are two end. There are two end. One is the medial end, one is the lateral end. Okay, so medial, the lateral end, there is a acromial end. Okay, and another thing is about, you have to understand, now we will see, this is the sternal acromion end shaft of the, now there is the medial end and lateral end. Medial lateral end is toward the acromion, medial end is toward the sternal manubrium, and here are the sternoclavicular joint. This is the sternoclavicular joint. This is first costal cartilage. Okay, and this is the costoclavicular ligament. Now move toward another slide. That is, if you see from the upper side, from the lower side. Okay, from the lower side you will see these muscles. That is from the upper side. This is from the lower side, and this is from the upper side. So from the upper side you can see trapezius muscle is attached and deltoid muscle is attached. I have already told you that deltoid is where is present. Sternomastoid muscle is attached. Okay, now come here to the inferior side. There is trapezoid and conoid tubercle, and coraco-clavicular ligament is attached to both of them. Okay, here is deltoid, there is the subclavius muscle attached to inferior side, and here is a costoclavicular ligament. Okay, and pectoralis major also attached. Now function of the clavicles connect the upper limb to the axial spine, transmit forces and give attachment to the muscle. Now come here, difference between clavicle horizontal, no medullary cavity, first bone to ossify membrane and commonly fracture. Now about the scapula. Scapula are three angle, three border and three fossa and three process. Triangle is superior, inferior, lateral. How? This is the superior, this is the inferior, this is the lateral. So triangle superior. Now border is the superior border, medial border and lateral border. Okay, now three fossa. One is the supraspinatus, this is the supraspinatus, and this is the infraspinatus, and this is the subscapularis fossa. Okay, three process: spine, acromion and coracoid. This is the, on posterior side, this is the spine, this is the this is the acromion process, this is the coracoid process. Okay, now second rib, spine, this is spine, this is the acromion. Now angle, border, fossa and process. Okay, now this is the acromion, coracoid process, suprascapular notch, superior angle. This is the, we have already discussed all of them. Okay, now about the humerus. What is humerus? Humerus have two end, upper and lower end. Upper end have head, neck, greater tuberosity, lesser tuber. Lower end have two epicondyle, three foci and trochanter capitulum. So this is the upper end, upper hand. This is the anatomical neck, the anatomical, this is the surgical neck. Okay, this is the greater tubercle, this is the greater tubercle, and this is lesser tubercle. Okay, greater tubercle, lesser tubercle, and between them this is intertubercular sulcus. Okay, now there are two condyle, one is the medial condyle and one is the lateral condyle. Another thing you have to know that the head is toward the medial side. Okay, and there are fossa, we will discuss the fossa. This is the head, anatomical neck, surgical neck, we have already discussed it. Okay, now lower end have, one is the trochlea capitulum. Now you have to understand that where is the trochlea, where is the capitulum. For that purpose you have to remember that crazy tulip, you have to remember this tip. So C and R, T and U. C mean capitulum is along the radius, so capitulum is along the radius, and trochlea is to along the ulna. Trochlea is along the ulna bone. Okay, so this is about the bit. Now coronoid fossa, one is the coronoid fossa, radial fossa, medial epicondyle, lateral epicondyle. One is the medial epicondyle, the other is the lateral epicondyle. So one is the radius and the ulna. Now come here, there is the articulations, upper end and lower end. Upper end is the shoulder joint and lower end is the elbow joints. Okay, so the shoulder joint is the ball and socket synovial joint. Lower end is the trochlea, articulate with the trochlear notch of the ulna. These articulate with the trochlear notch of the ulna, the lower end. Okay, the trochlea along the ulna, but it attached with the trochlear notch of the ulna. Now capitulum. Capitulum is actually attached with the head of the radius. Okay. Now bones on the forearm. Forearm have two bones. One is the radius and the other is the ulna. Radius. This is radius. Radius have head on the superior side, not on the distal side. Okay. Proximal side. So radius is toward the lateral side, ulna is toward the medial side. So you have to remember this. Now radius. Each has two end, upper end and lower end, and shaft. Okay. Now ulna, we will discuss ulna. Ulna upper end have two notches and two process. Two notch and two process. Two process. One is the olecron process and another is the coronoid process. Coronoid. Uh, in the scapula there is the coracoid process. Okay, so this is the coronoid process, and this is the trochlear notch. Trochlear notch we have already discussed. This is the radial notch because there is the head of the radius attached here. And now about the trochlear notch have radial notch. Now the process have already discussed. Okay, two process. One is the olecron process, another is the coronoid process. Here is the supinator crest. Supinator crest means here the supinator muscle attached here. Okay. Now this is the radial notch, coronoid process, olecron process, ulnar tuberosity. Now come here to the ulna, lower end. Lower end have one head for the style, one head and styloid process. Head articulate with the ulnar notch. Actually, we have in the ulna radius. This is the ulna. Okay. But you have to remember lower end have head of ulna. Okay, the head of ulna is present at the lower end. That head is articulated with the ulnar notch of the radius. For example, this is the radial. This is the ulnar notch on the of the radius. This is the radius. So radius is ulnar notch. Okay, and it is a head. This is the head, and other is the styloid process. Styloid process can be palpated if you place your thumbs etc. here. Okay, you can palpate it. Okay, now it's separated by the carpal bone from articular that does not take part in the formation of the wrist. You have to remember that this ulna bone not take formation in the along with this bone because they are separated. They have a radial notch. Now about the radius. Radius have three parts. One is the head, another is the neck, and other is the radial tubule. Upper part has three hands. One is the head. This is the head. Okay, this is the neck. Okay, and this is the tuberosity of the radius, radial tuberosity. Okay, now we will discuss the muscle. One head, two neck. One head. This is the head. This is the neck, and this is the tuberosity. Okay, now can you see there are annular ligament. You have to remember this ligament. That is the called annular ligament. Annular ligament and is present here that help the attachment of the radius. Now radius have lower end five surfaces: anterior surface, posterior surface, medial surface, lateral surface. Okay, and anterior surface you can see this is the anterior surface and posterior surface. Posterior surface have dorsal tubercle. You have to remember that posterior surface of the radius have dorsal tubercle on the lower end, and the head of the radius is present upper end. Okay, but the head of the ulna is present at lower end. These are both of them are opposite. Okay, now anterior side, posterior side have now medial side have ulnar notch. Medial side have ulnar notch. There are ulnar notch on the lateral side form a styloid process. This is the lateral side and they form a styloid process. So there are this is also styloid process of the ulna. This is styloid process of the radius. Okay. Inferior surface articulate with the scaphoid and lunate. You have to remember SL scaphoid and lunate articulate with the radius. Okay. So this is the radius. This is the ulna. But if you supine at supine position, this is like this. Okay. Now skeleton of the hand. three part. One is the carpal bone, metacarpal bone, and phalanges. So this is the carpal bone. And carpal bone, how can you remember? Just like I will tell you, you have to. She looks too pretty. She looks too pretty. Try to catch her. I will write here for you. You have to write. She looks too pretty. She looks too pretty. Try to catch her. So she means scapide. This is the scapide. This is the lunate. This is the tricutum. This is the falciform. So this is the first row. Okay, proximal row. And the distal row is try to catch her. Trapezium, trapezoid, capitate, hamate. Trapezium, trapezoid, capitate, hamate. These are the second row. Okay. Now shoulder girdle. Shoulder girdle have two bones. One is the clavicle, another is the scapula. This is called the clavicle, and another is the scapula. This is the scapula. Okay, clavicle have two end. We have already discussed this. Okay, but why this is coming again? Now here are the attachment of bones, etc. Okay, so if you want to discuss, we will discuss it one by one. Now again we will come here and tell about the shoulder girdle, have then fracture of the shoulder. This is actually the muscle. Now let's come here. Okay, scapula have triangle. We have already discussed it, but now muscle attachment. Okay, so here are the supraspinatus muscle attached, here the infraspinatus, and here the for example, this is the one number position, this is 7. So at 7 there is the teres minor. So here are the teres minor, here are the teres major muscle attached, and here at the 9 the latissimus dorsi attached to at 9 position. Okay, now at 3 there are subscapularis muscle are attached. Okay, 4 at 4 there are the levator at 4, there are levator scapula, and here at the 5 there is the rhomboid minor, and at the 6 there is rhomboid major. Rhomboid minor, rhomboid major muscle are attached to here. Okay, now rhomboid minor, rhomboid major, teres minor. Now the three dorsal lip of the letter teres minor, teres major, latissimus dorsi. Okay, this is attached here. Now 18 muscle. Now there are long head of to the two glenoid tubercle. One is this tubercle in superior glenoid tubercle, one is inferior. So here is the muscle attached that is called, for example, long head is the supraglenoid tubercle. To this area, the supraglenoid tubercle muscle is attached. Long head of the bicep muscle attached to this area, supraglenoid tubercle, and long head of tricep attached to the infraglenoid tubercle. Okay, this is the infraglenoid tubercle. The acromion deltoid at 13 position there is the deltoid muscle attached. At 14 there is the trapezius muscle attached. At 15, 16 short head of the bicep and coracobrachialis. 15 and 16. Where is the 15, 16? Actually, coracobrachialis is attached to a coracoid. This is the coracoid process. Okay, and short head of biceps and coracoid process. This is attached to here. Okay, and pectoralis major. 16 pectoralis minor is also attached to here. Where they are not showing again. 17 at 17 position. Here the pectoralis minor muscle are attached. Okay. Now come here to ligament of the scapula. Scapula have suprascapular ligament, coracoclavicular ligament, conoid ligament, trapezoid ligament, coraco acromial ligament, coracohumeral ligament, glenohumeral ligament. Okay, these all ligament are attached to here. Okay, now about the humerus. Humerus have, and we have already discussed it. Now to the greater tubercle, what things are attached, and to the lesser tubercle. So this is the greater tubercle. Now we will tell about the articulations. Upper shoulder joint, head, remove this muscle attachment. We have discussed infraspinatus, all have these are discussed. Okay, now another thing is the supraspinatus, infraspinatus, teres minor. They are attached to a greater tubercle. Okay, they are attached to a greater tubercle. And the subscapularis, these four muscle form a rotator cuff muscle. Okay, now muscle attachment of the humerus, there are seven insertion are here. You can see at the 5. There is the pectoralis major muscle attached laterally, and at the 7 there is latissimus dorsi, and there is the teres minor. Pectoralis minor, latissimus dorsi, and teres minor. Teres major. Okay, so these are to the insertion of the muscle. Okay, now lower end of the humerus, medial epicondyle, lateral epicondyle. Medial epicondyle is the common flexor origin. Actually, the medial epicondyle is actually, this is the let this is not posterior side, and posterior it become anterior side. So this is the medial epicondyle. This is the medial epicondyle. This is the lateral. So common flexor origin to medial epicondyle. This is the medial epicondyle. To medial epicondyle, there is common flexor origin. All the flexor muscle attached to it. Okay, and common extensor muscle attached to the lateral epicondyle. Okay. Common extensor also are all of them are attached to extensor. Now nerve related to the humerus. One is the axillary nerve, radial nerve. So this is the axillary nerve. This is the radial nerve in the radial groove move, and this is the ulnar nerve move behind the epicondyle. These are behind the medial epicondyle. This MCQs comes again and again. Okay. Now fracture. Humerus fracture at the axillary nerve, humerus fracture. It's at surgical link, for example, at surgical link, the axillary nerve were damaged. At the mid shaft, there the radial nerve were damaged. At the medial epicondyle, there will be the ulnar nerve damage. Okay, pectoralis region. We will after this we will discuss the pectoralis region, and after something pectoralis region, forearm region, and arm region, head, etc. All of them we'll discuss one by one. Okay.